Hello and welcome to the short introductory video on Fetal Alcohol Spectrum Disorder. In this video, we will explain what Fetal Alcohol Spectrum Disorder, or in short, FASD is, what causes it, and how it presents in children and adults. Please note, this information should not be used to attempt diagnosis, and as such, the facial features of FASD will not be shown. Let's start with what causes FASD. When an unborn baby is exposed to alcohol during pregnancy, it can interrupt the normal embryonic and fetal development, and it can lead to a range of birth defects and negative birth outcomes. If we look at the signs and the symptoms, it is important to understand that not all individuals affected by alcohol exposure during pregnancy show the same signs and symptoms. There are specific diagnostic labels assigned depending on how the affected person presents, but they all fall under the same umbrella term, Fetal Alcohol Spectrum Disorder. This term highlights that the severity and the nature of the damage caused by alcohol exposure during pregnancy is variable, and as a result of this, affected individuals lie on a spectrum. The reason alcohol exposure during pregnancy is so harmful is that alcohol is a teratogen. A teratogen is a substance that can cause embryonic and fetal malformation and damage. Other teratogens such as nicotine, lead exposure, and some prescription medications like thalidomide can also cause fetal harm, but not FASD. In this picture, you can see how an embryo and fetus develop over time and how alcohol can interfere with this development. At the top of the image, you will see development broken up into weeks. The pink and the green bars highlight when during development different systems and features develop. The pink sections highlight the most vulnerable periods of development. Exposure to teratogens in this time will have the greatest impact on development. The green sections indicate that the most critical period of development has passed. However, the development is still sensitive to damage. The central nervous system and the brain in particular is what is most frequently affected. It is therefore important to note that the brain remains vulnerable to damage for the duration of the pregnancy. An important takeaway from this image is how early, essentially from conception, alcohol can have an impact on the fetal development. Considering that the major structural development of vital organs, the pink areas in the image, are already completed at about 9 weeks of pregnancy. It is often the case that alcohol exposure occurs before a woman realizes or suspects that she is pregnant. Damage can therefore occur well before pregnancy recognition. What is not indicated on this image is the impact that alcohol has on pregnancy duration and fetal growth. One of the possible consequences of prenatal alcohol exposure is premature birth, as well as pre- and postnatal growth restriction. Individuals affected by alcohol exposure are often stunted in weight and height, significantly lower than expected for their age. We can therefore conclude that there is no time during pregnancy when an embryo or fetus is not vulnerable to alcohol exposure. It is also essential to note that there is no risk-free amount of alcohol that can be used. The best decision is to completely abstain from alcohol use during pregnancy or when a woman or a couple is planning a pregnancy. How does FASD present? As discussed, there is a spectrum of disorders and not all individuals are affected in the same way. Those affected by alcohol exposure can present with stunted growth, organ damage, birth defects, as well as cognitive and behavioral disorders. Many individuals will also present with a pattern of characteristic facial features associated with FASD. The presence of these features does not guarantee a diagnosis of FASD, while the absence of these features does not mean an individual is not affected. If we focus on neurodevelopmental impact, research has shown that it is generally associated with cognitive delays and deficits. Affected children may miss developmental milestones and perform significantly poorer than their peers on standardized cognitive assessments. Due to these deficits and delays, children with FASD often have disrupted or poor educational experiences. They can struggle in school and leave school early. They struggle with attention, inhibition, abstract thinking, and socio-emotional development, among other challenges and deficits. The delays and deficits also impact on behavior, and children may struggle with relationships, learning and following rules, and may display inappropriate behavior. This includes sexually inappropriate behavior. The damage caused by alcohol exposure is permanent and persists into adulthood. This is often reflected in struggles with finding and keeping employment, difficulty forming and maintaining relationships, and challenges with independent living. Due to the delays in socio-emotional development, individuals with FASD may easily be manipulated and taken advantage of. While they may come into conflict with the law as perpetrators of violence, they are more often victims of violence and abuse. They are not inherently violent or abusive. The final message of this video is that FASD is generally preventable when pregnancies are planned and expectant mothers know they are pregnant. If they abstain from alcohol use, their child cannot be born with FASD. If, however, there is alcohol exposure, the impact is lifelong. Remember that while both children and adults face multiple challenges with early intervention and support, they can lead happy and fulfilling lives, and they can positively contribute to society in their own unique ways.